So our next panel is on artificial intelligence and cancer care. Our moderator is Ranjan Nag. He is a professor at Stanford. He is a venture capitalist. He's a former entrepreneur. And he has the highest VO2 max of anybody I know. So with that, Ranjan, welcome.
Thank you. Is this working? Great. Excellent. Oh, we're missing one person. Where's she gone?
Oh,
There
there
she is. Kamudi. Excellent. It's so nice to be here. And I was asked to talk about artificial intelligence. So the grand vision of AI, just like we heard in the last panel, maybe you don't need to do any trials. You just do the computation, click the button, and it comes out with the answer. Right now, our GPT systems are as clever as a PhD in one topic. If you get to super intelligence, 2029, some people think, there's a PhD level intelligence in every topic. And maybe we need that to solve these difficult problems. Yes, so I'm a venture capitalist. I'm a teacher here at Stanford. Some of you may have taken my courses. I'm teaching AI for grant writing right now. And if you need money, that's free money. And an AI crash course. Roger was my student. Thank you very much. And maybe some of you were. But we've got some super panelists today, and I'm going to introduce them. And then we're going to go straight into discussion. So first of all, we've got Dr. Kamudi Bawe. Kamudi is a founder and principal at YOM Consulting Services. She helps small biotech companies establish end-to-end AI, ML, multiomics, translation biology approaches to both therapeutic and diagnostic development. She also founded YOM Wellness, where she combines her scientific expertise and integrative healing knowledge to help cancer patients navigate complex health choices for themselves. And Kamudi holds a PhD in public health and has oncology research experience spanning more than 20 years. Then we have Felix. I think you've heard from Felix before. Felix is co-founder of NeoTela, an AI-powered cancer monitoring and surveillance, as well as personalized immunotherapies targeting liver through precision diagnostics and next-gen cell therapies. Felix is mentor for Stanford Care, as well as the Stanford Biodesign program. He exemplifies the mission of Stanford Biodesign, bring the world's most promising minds into one room to investigate, innovate a healthier world for all. And he distinguishes himself as an exceptionally dedicated fellow. Finally, we have Dr. Nabil Adam. Nabil is Professor Emeritus at Rutgers University and co-founder and CEO of Falcon, a startup focusing on AI applications in medicine and healthcare. His first startup, which focused on the pharmaceutical industry, was sold in 2008. So an entrepreneur at heart. So let me jump straight in and think about AI. And Roger sent me this article and said, 2 years ago when ChatGPT sort of started to pop up and AI, I think I've been in AI for 40 years at this point. My first system was in 1983. So people think it's just a few years old. But when it first came up in mainstream, where the most popular programming language switched from Python to English, lots of universities, including this one, were pretty nervous about using it on their students. And now, actually, quite a lot of universities now have said, well, actually, go and use it. Go and use it. But by the way, we expect bigger expectations. We expect higher quality output. But medical schools are still concerned. We've still got these things about, well, what if it prescribes the wrong thing? And at Stanford, there's an enterprise version of all this CYA language. Do not use it for any clinical practice. And yet, I've seen this blog post that the latest systems are now giving reasoning. It does get it wrong occasionally, but it tells you can tell why. Because it gives you the reasoning, tell you why it's going. Can AI be used in medicine? Who will go first? Let's start with Felix.
I teach medical students, I teach doctors all around the world, and AI in medicine is here to stay. There's no way of turning back. It's a question of how we're going to use it. It's a question of how we're going to adopt it. It's a question of how and who's going to pay for it. So so AI is here to stay, and AI is meant to empower both patients and families, as well as clinicians and administrators, on better outcomes for patient care. Where cancer is concerned, I think that cancer, it's a very sensitive topic as well. The question lies in, do I want to know? Do I not want to know? But I'm of the view it's better to know than not to know. So I'm trained in hepatology, so I will focus a bit more on liver cancer because it's a totally silent killer. But I will not talk a lot because I'm going to present later in the afternoon. But yes, to Rhonda, who is the veteran here, AI in medicine is here to stay and it's going to make greater impact.
So Felix says it's here to stay, but are people actually using it now? And if they are using it, what are they using it for? And if they're not, why not?
Okay, thank you. I'll speak to this a little bit. All of you must have seen the news that's made the splash recently about Microsoft and the MyDxO and how it's so much more efficient than some physicians who were asked to diagnose these cases. Now let's dive a little bit deeper into that news though, because news articles are flashy about the latest, but let's see what it actually did. What was behind the scenes in this particular tool, right? That's the latest and greatest and the forefront of what AI can do. It's the news articles are saying, oh, is it going to replace doctors one day? Now we have to remember what Microsoft built is a tool called an orchestrator, right? It's a multi-agentic system. I'm bringing in AI jargon. Those of you who are much more well-versed can, kind of challenge me on everything I say here. But multi-agentic system. So what the orchestrator does, it puts together 5 agents. An agent is a step beyond what most people are talking about, ChatGPT, Claude, Gemini, all of these. An agent not only passively gives you information in a nice, beautiful format, but it actually can do stuff, right? It can book appointments, it can do those things. So they've put together 5 of these, and now it's acting like a tumor board would or a group of doctors would. However, you have to remember that this is trained on, or it's rather using the LLMs that already have access to all the information that's out there, including the NEGM reports. Has such a system been created for a real-world situation where there are a number of false positives that could crop up, or there's other concerns? No. This is experimental. It's sensational at the moment, right? But there's a really long way to go in terms of ever replacing doctors. It would be more like a tool that doctors use. One caution there would be, I'm just going to put one comment here, which is probably talking to a question that maybe you were going to ask me later, but I'm going to say this. As we humans are using these more and more advanced tools, the tendency of the human brain tends to go towards a little bit of laziness. And that's something I think we have to be cautious about. I'll stop there.
Okay, excellent. Laziness. Does it make us lazy? I mean, I asked this question yesterday to a class. Does AI make us dumber? Or does it actually make us cleverer? We have these tools, so, and I think the response was if at our level, it makes us cleverer, but a teenager, it might make them dumber because they're lazy, right? They'll just take one answer. But if you're a doctor, you might double click. But okay, Professor Nabil. Okay, what do you think? What do you think is the sense of doctors? Are they skeptical or are they frightened? What word do you, or are they actually using it in secret? But what do you think? What do you think people are doing in medicine?
I think in terms of AI in medicine, that certainly is here to stay. And I think it's good to realize that. But also realize that it is an empowerment to patients and clinicians, but it has limitations, and we should be work hard on addressing those limitations. So, for example, limitations in terms of quality data. A lot have spoken about it. The validation of the models is very important. And the skepticism is healthy. I think it keeps us all in our toes in terms of researchers and clinicians. So we want that to be there. But also, let's think why the skepticism, because clinicians need to be convinced and have some trust in the results that the AI models provide. That's why explaining the results and how it came about, whether it's right or wrong, is important. Whether the physician would be convinced or not, that's a different. But the ability to explain the results, how it arrived, how the model arrived, those results are really important. Another, it's actually interesting, by the way, there's a recent study that was published in JAMA just a few months ago that showed that most of the oncologists that were surveyed, most of them recommended that their patient would consent to the AI models used in their treatment plan. Okay. So that is
The patients would consent to
Exactly,
it.
yeah.
So when the patients were asked, they said, yes, go ahead.
right. The patient would consent to the result. So that actually shows that there is a skepticism, but also there is trust building from the physician and clinician part of the equation.
All right. So AI models, they have utility in the diagnostics and the drug discovery space. But usually the critique, I forget who, maybe it was Comey who said, the false positives, the false negatives. But humans make false positives and false negatives too, right? So I'm not sure who asked. Comey, maybe I'll ask you this. The false, if something has a lot of false positives or false negatives, is it still useful? Or do we say, well, actually it generates more questions, I have to spend another $300 on another test to double check and a follow-on test behind that. And before I know it, spent $4,000 and something that didn't really matter anyway. Or does it catch early my phase 1 cancer in pancreatic cancer?
I think, thank you for this question. It's extremely useful, as we're already
So
saying.
even if
because-
it
Yes, it's extremely useful. It's extremely useful as a starting point. I mean, I talked about this news right now and how it cannot replace doctors yet. It's just a starting point. Meanwhile, let me address another aspect of the question you asked me earlier. What are the uses? There are patients and patient groups that are using AI, like Brad mentioned earlier. And something about my background, which I hadn't put in the little blurb, is that I have had the honor of working with Marty Tenenbaum and Cancer Commons as well, working directly with patients and their families in the past. So that I've built upon through Yom Wellness, where I use integrative healing as well as a component when I work with cancer patients and their families. So cancer patients and caregivers are using ChatGPT and just Claude or any of these LLMs that they have access to ask and have conversations about the questions that they cannot ask anyone in the times that they're not visiting with their doctor or their nurses. And so it's extremely useful, but with a word of caution, because the answer you're going to get depends on the question you ask, as we all know, as we've all dabbled with our own conversations with these LLMs, right? We're all learning that the answers you get depend on the questions you ask, depends on the data it's being fed as well. As much data as you give it, it's going to get better and better. So if you stop, it's kind of like the question being asked is that, is it better to be half knowledgeable or zero, ignorance is bliss, or completely? So in the reality, none of us here is completely knowledgeable. All of us are at different levels, right? And so it's extremely useful as a starting point, is what
Yeah, so I mean, I think does it? I mean, when I used to go to my doctor, she said, don't believe anything you read on the internet. Now she says, well, Ron, what do you think it is? Because she knows I've spent 2 hours researching it and we only have a 10-minute consultation. So I'm is it going to be a discussion instead of a white coat, you just do what I tell you to do, where the doctor is actually expecting the patient to have more of a back and forth? What do you think, Nabil?
Yeah, I think that's an interesting point, though. It's also, and I think we're speaking about the Asians. That's where maybe we can focus having the Asians take care of the routine tasks that currently clinicians does and spend time on, and release her from those routine tasks and have her spend more quality time with the patient. Have the Asians, have the AI capabilities and model prepare the history of that patient that I'm going to see in few minutes, and have that summary of the MRI, the different reports, all of that. Give me an overview, holistic view of the patient, the treatments, adverse events, comorbidities, and so on over the past several visits. Have all of that for me prepared so that when I see the patient, I don't have to spend time going through this and memorizing. Have that in front of me and maybe focus more on what is at hand at this point.
All right. Okay. So this is back and forth. We're thinking that these systems are not quite perfect, but we can accelerate the treatment and the discussion, maybe some more accuracy. But how do we get to this sort of holy grail, and when will we get it to it where it just tells us, it just gives us the right treatment? How do we make it AI more accurate and it just gives us the right medicine, the personalized? Maybe Felix can comment. How do you make it better? Why can't we make it perfect?
I think that the future of healthcare would be even more precise, given, we've got very smart engineers, we've got computational biologists, we have got scientists, and all this, and so someone mentioned about digital twin, and I'm a big fan of, and the future is about digital twin. But the only thing is this is who's going to pay for it is, but I believe that will somehow play a part in where healthcare is going towards, in terms of precision medicine, in terms of personalized healthcare, in terms of innovation medicine, and in terms of where the future looks like. So back to your question, I think I would put my bet, given that I'm also a venture partner, I would put my bet that this is the golden age of healthcare, never seen and never to be repeated ever again. And I think that by probably 2035 or so, the dynamics of healthcare, both to the doctors, both to scientists, both to researchers, will be very, very different from what it is today. And the way how we teach medicine in the university will also change, I'm certain of.
All right. Okay. So, no, I work on aging, which is like even grander than cancer's just a subset. So I think about almost the opposite of personalized medicine. Can you solve all diseases? Can you solve all cancers all at once? Which we've been telling people for years that cancer's not one thing. So the Chan Zuckerberg initiative, when it first started, at least the news article I read, they said, I think it was UCSF and Stanford, and told the Zuckerberg family, said, look, we can cure all diseases by the turn of the century. Just give us 500 million. And they did give them 500 million. So with AI, let me ask each of you this. Turn of the century, 70 years from now, will all diseases be cured? And then we don't have to worry about the cost because no one will get ill. Yes or no, and how? Kamudi, first of all.
All right.
This
This
is
is me.
turn of 70 years.
All right. So I think absolutely it depends on all of us. We all, lay people, have to also be participatory in this. We already have the tools. People are wearing the Apple Watches, wearing all kinds of technology. The opening session today was about the wearables and the time that's spent between doctor visits on the daily, our daily routine, daily health care that we do for ourselves. So if we're all able to, in pockets, participate in collecting the data around that and turning that data into useful and meaningful information, then there's a lot of hope.
So that's the how, but it's yes or no. 70 years, no
maybe,
diseases.
maybe.
Nabil, maybe Nabil will be more.
Well, I'm not sure we'll be able to cure more. The idea also, if you look back, we didn't know of some of the diseases that we know now. So it is a discovery as we go along. So for sure, we'll not be able to you cure all the. But I think we have to take it not one step at a time, one patient at a time. Back to Marty's point, we have to think in terms of that specific patient and how they cure it, how AI can actually help that specific patient with the entire background, not only the medical, but also, I think it was the holistic view of that specific patient.
I have a slightly contrarian view, just if I could interject. The aging, people who work on aging research almost think the opposite. They say, well, yes, each patient is different. Yes, obviously. And yet, if we can actually compute every single possible pathway that goes through every single disease and see what the most common pathways are, maybe we can get one thing that cures lots of diseases all at once, so-called. So the aging field is different. It's the opposite to oncology, usually traditional oncology. But so you say no. I think I heard you say no, but we've got some ways to do it. So we've got maybe, Felix, 70 years. Can we cure all diseases?
In this context of cancer, I am confident that we can cure cancer. Okay, with technology like CAR T cell, armor T, with immunotherapies, I am quite confident. The intellect scientists of the world, be it here from the US, out in UK, in Cambridge, coming together, putting our minds together, I believe, and I'm hopeful that we can cure cancer. And we can start off with some of the low-hanging problems before we go to the deeper problems. But at the same time, and this is what I want to emphasize, many a times people are not aware. So surveillance and monitoring is critical. Secondly, your lifestyle and your diet is also critical. So if I empower you with all the necessary information in the palm of your hands for you to look after yourself and that of your families, will that make a difference? I think it will.
All right, so Felix says yes for cancer. We didn't get an answer for the other one. And the how was smart people and behaving yourself. But I still like chocolate cake. That's my problem. Let's have some audience. Any comments or questions from the audience, because none of us know how to solve everything. Gentleman over there on the right.
My high school. Anyhow, so we're pretty bright kids, and some of us came to California, and some of us went to the American South. And my colleagues from high school have become Southerners. And I can tell you, they hate California, they hate Silicon Valley, and they don't want to know that they're in charge of anything. And No, really.
No, I can understand that.
I don't want to go into a
No, no,
religious.
so-
I don't want to go into a religious thing, but
So-
their minister, they're telling them they're not in charge of
So
it.
your comment is if the solution comes out from fancy Silicon Valley, you have to still get people might be resistant. And
They
that's
might.
kind of-
They might even go on a campaign against it.
Yeah. So it's interesting because Francis Crick went to my high school actually in England, in a town called Northampton. So yeah, I mean we have the anti-vax movement. There's many. I mean, there's many riposts to many ideas because we do know medicine is basically a trade-off. You know, some people it doesn't work, some people it does work, and people have to do that analysis, and that's not usually explained to the masses. I mean, that's really the doctor's job to figure out that discussion. Who else would like to make a comment? Yes, over here.
So my comment is, in order to really cure cancer or any other diseases in whatever number of years, first thing we need to do is remove all the chemicals from everything, including the makeup. Like, I read all the ingredients, most people don't. Like, if you take any product of any of the over-the-counter, which I know that here kids start using since middle school, it has a lot of different things which can cause cancer later on. So it's sodium benzoate, which is in all the store-bought food or frozen food and other things we buy. So I think in order to really get rid of diseases, we need to go to the source of what's causing them. And one of the easiest thing is, I don't know if anyone has done research in all the ingredients in different things we buy, which later on with continuous use can lead to diseases, including cancer. If we handle that part, half of the diseases might get cured or might not even happen. So it might be even better than a vaccine.
So it might be, maybe this is an AI. This is the AI panel section, but you may have advisors on your watch before you take a bite into something, or
Yes.
realizes that you have a life logger type thing, or you have spectacles. You're about to not behave yourself or do something that it warns you, a bit like that Terminator.
Yeah,
Okay.
like if you can train the AI to
Okay,
really figure it
one
out.
question or comment. One more question over there.
Hi, I'm Lisa Gashara. I'm a global health student and just interested in listening in today. I was wondering where health equity kind of comes into the conversations and how we're going to be socially responsible, especially including low and middle income countries in the conversations of developing tech-based
So let me just jump
solutions.
in. We have final time. I mean, health equity, the AI part is maybe you don't access to doctors. Even if you have access, the copay is ridiculous. The insurance ridiculous. Maybe access the AI system. And Nabil sounds like he wants to comment.
I thought that actually, in a way, relates to the data that we train our model. So if our data is biased, then that's what the model is trained on. So a challenge in terms of having quality data. Quality means a lot of things. One of them is to make sure that there is a free of bias. Again, never 100%, but at least if we are conscious of that and try hard to tackle that, I think we get further away.
Yeah. That's the health equity issue at the AI level. Okay, I'm off, right? Is that right? Is it lunchtime? Or no, someone else? Concluding remarks. Thank you. So we've had some brilliant comments here. I think the general theme here is, AI is here to stay. It's not perfect, but I'm actually more optimistic that in the 2030, 2031, I think we should be aiming bigger. Not curing liver cancer, which is great. Not curing pancreatic cancer. Cure all the cancers all at once and all the diseases, because we now have the tools. We just have to use them.
All right. Thank you, panel. Thank you, Ranjan, and the rest of the panelists.